Hello, my name is Stephanie Opsmer, and I would like to thank each and every one of you for attending this presentation regarding the Diabetes Health Education Program. A health challenge of concern that affects close to 29.1 million people within the United States is diabetes mellitus. This condition is the 7th leading cause of death in the United States. Diabetes occurs when the body is not able to produce enough insulin or when the body cannot respond to insulin the way it should. Insulin is a very important hormone that the body needs to be able to both absorb and utilize glucose as a source of fuel for the body's cells. When the body is not able to properly use or respond to insulin, blood glucose levels become elevated. When this occurs, other metabolic issues occur, which leads to the development of serious complications. There are 3 common types of diabetes, which are type 1, type 2, and gestational. Type 1 occurs when the body is no longer able to produce insulin. Type 2 occurs from both insufficient insulin production and resistance to the action of insulin. And gestational diabetes is a common pregnancy complication which can lead to perinatal complications. Diabetic complications may be prevented or delayed through effective therapy. Close to 28% of Americans are undiagnosed. Around 86 million American adults have the risk of developing type 2 diabetes within the next several years due to elevated blood glucose levels. When diabetes is poorly controlled, complications relating to diabetes become more common and more severe. And those that are diagnosed, the all-cause mortality rate increases by 1.8 times when compared to those that are undiagnosed. The risk of heart attack increases by 1.8 times in those diagnosed. Also, in those diagnosed, it is the leading cause of kidney failures, adult onset blindness, and lower limb amputations. In the U.S. and throughout the world, the number of diabetes cases continues to rise. With the increase in the number of individuals with diabetes and the earlier onset of type 2 diabetes, there are numerous growing concerns. One concern is the potential for increases in the prevalence of complications related to diabetes due to obesity rates rising. Another concern is the increase in the number of those with diabetes and their need for complex care, which may overwhelm the already existing healthcare systems. Improved diabetes management and prevention has been found to lead to individual and societal benefits. There is a need to complement the improved diabetes management strategies with primary prevention efforts such as health education programs among those at risk for developing type 2 diabetes. According to the Office of Disease Prevention and Health Promotion, in the U.S., there are disparities in diabetes risk, such as minority populations, and these populations include African Americans, Hispanic, Latino Americans, American Indians, and others. They are more likely to develop type 2 diabetes. Diabetes prevalence rates among American Indians are 2 to 5 times those of whites. On average, African American adults are 1.7 times as likely, and Mexican Americans and Puerto Ricans are twice as likely to have the disease as non-Hispanic whites of similar age. There are also barriers to progress in diabetes care. One is system problems, such as healthcare system design challenges. Another is the substantial increase in those with diabetes. With this increase, there may be a decrease in the overall attention and resources that are available per patient to treat the condition. This health challenge is concerning due to it being immense and complex, which is why preventive care practices such as diabetes health education programs are essential in improving health outcomes for those at risk for or with diabetes. Diabetes mellitus in target population. The City of Virginia Beach needs to plan, create, and implement more health education programs for those at an increased risk of developing or with diabetes mellitus, or more specifically, type 2 diabetes. 5 focus groups in the City of Virginia Beach were conducted in 2016 to gather information regarding the health needs of the community. Those chosen for the focus groups were community members that represented a diverse cross-section of city residents. It was noted that there was a special effort towards soliciting input from underserved and underrepresented populations. One of the major key health issues participants identified impacting the community of Virginia Beach was diabetes. The health needs listed most often as concerns were obesity and related issues, including difficulty accessing healthy food, the need for guidance on healthy behaviors and lifestyle-related diseases such as diabetes and hypertension. As mentioned, one of the needs is for more guidance on healthy behaviors as well as the diseases that accompany poor lifestyle choices such as diabetes. A health education program aimed towards guiding individuals on how to develop and maintain healthier behaviors is needed based on the input of the community members. The local area that the Diabetes Health Education Program is directed towards is Virginia Beach, Virginia. The target population is those ages 18 years and older that have been diagnosed with diabetes or at risk for diabetes. As of 2015, the population of Virginia Beach was estimated to be around 452,745. Virginia Beach is the most populous city within the Commonwealth of Virginia. It is also the 41st most populous city in the United States, which makes this area a prime target for health concerns. Diabetes is noted as one of the 14 leading causes of deaths in Virginia Beach. In 2014, the age-adjusted mortality rate per 100,000 individuals within Virginia Beach was 19.5. Compared to Virginia, the city's residents had higher mortality rates for diabetes as well as other leading causes of death. In 2013, there were 81 total deaths from diabetes in Virginia Beach. 50 of those deaths were Caucasian individuals, 23 were African American individuals, and 8 were individuals of other unspecified racial backgrounds. There was an increase from 2012 to 2013 in the percentage of Virginia Beach adults, ages 18 and older, with diabetes. Diabetes is one of the ambulatory care-sensitive conditions treated in Virginia Beach. Events related to these ambulatory care-sensitive conditions may be prevented with regular good outpatient care. This care should include early intervention and complication prevention, as well as prevention against more severe disease. Around 8.6% of the city's adults reported a diagnosis of diabetes, compared to close to 9.8% in Virginia in 2013. In Virginia Beach, the hospital discharge or the hospitalization rate for diabetes was 14.0 in 2013. Hospitalization for this condition is considered to be a measure of access to proper primary health care. A lower rate is supposed to show that the primary care system is functioning properly and that access to appropriate health care is easily obtained. The Diabetes Health Education Program aims to prevent and or delay the onset of type 2 diabetes in those who are at high risk or pre-diabetic. It also aims to help those currently struggling with diabetes, type 2 diabetes, and type 1 diabetes. The program's projected goals and objectives seek to educate and encourage proper nutrition, physical activity, maintaining healthy blood glucose and insulin levels, as well as lifestyle balance. To help attain the overall purpose of the program, goals, and objectives, Goals and objectives were created to help the participants learn more about diabetes, so they are able to better self-manage their condition. According to the Indian Health Services Division of Diabetes Treatment and Prevention, goals should be simple, results-oriented, and inclusive. Objectives should support the program's goal and should be very specific. Since the goals of the program deal with either prevention or delaying or better management of diabetes mellitus, there should be smaller goals supporting them. The method that will be used to achieve the program's goals and objectives will be the SMART method. This method is often used in health education interventions. SMART is an acronym for specific, measurable, attainable, relevant or realistic, and time-bound. For specific, the goal should be simple, detailed, focused, and easy to understand. For measurable, the goal should be objective and observable. Attainable means that the goal should be reasonable and one that can be completed. Realistic or relevant refers to the goal being of importance to the target population. It also should be based on the population's strengths and circumstances such as accessibility, transportation, neighborhood, affordability, etc. Goals should also be time-bound, which means that it should have a start and a completion time. This provides the person with motivation to start and complete a goal within a reasonable amount of time. Campaign goals and objectives. One goal is to increase awareness of diabetes within the local community. An objective for this goal is to increase the percentage of people that know how to prevent diabetes by the end of the program. Another goal is to increase the physical activity or exercise levels among participants. An objective for this goal is to increase the total daily amount of physical activity performed up to 5 days a week for 30 minutes each session by the program participants by the end of the program. Another goal is to increase healthy eating behaviors among participants. An objective for this goal is to increase the amount of lean proteins and vegetables eaten while decreasing the amount of soda, drink, and unhealthy foods such as potato chips, fast food, etc. eaten by the end of the program. A fourth goal is to improve A1C levels among program participants. An objective for this goal is to lower participant A1C levels to less than or equal to 7% by the end of 6 months. A1C tests are completed every 6 months, while sometimes up to 4 times per year. A fifth goal is to improve participant knowledge of how to monitor their own blood glucose and insulin levels. An objective for this goal is to increase the knowledge of how to work glucose self-monitor machines by the end of the program. Another objective for this goal is to increase the knowledge of proper blood glucose and insulin levels through education by the end of the program. The sixth goal is to improve participant lifestyle balance. This will be done through increasing participant knowledge of self-coping methods by the end of the program. The final goal is to increase self-management skills for either the prevention or healthy maintenance of diabetes of the participants. This will be done by increasing the overall knowledge of the participants regarding the previous goals by information provided to them throughout the entire program. The mentioned goals and objectives are SMART. They are broken down into small and specific tasks. They can all be measured and observed. They are reasonable and can be completed. These goals and objectives are realistic and are based on those either at risk for developing diabetes or have a current diagnosis of diabetes. They are time-bound with a completion time. Campaign design. The Diabetes Health Education Program will include diabetes self-management education, or DSME, and support to those aged 18 and older and live within the city of Virginia Beach. The program will be offered through the local hospital, so a larger amount of people with prediabetes or people at risk of developing type 2 diabetes, currently have type 2 diabetes, or those with type 1 diabetes can be reached. The program will also be streamed online during class sessions, so the program reach can be greater. The setting will be comfortable and inviting. Common language will be utilized throughout the program by maintaining a 5th grade reading level in the information provided. Both English and Spanish versions of certain handouts will be provided, but the oral presentation and the PowerPoint slides will be in English only. If time and cost allows, there may be a translator at each class. By including these factors, the program will be culturally and age appropriate to improve outcomes and effectiveness of the program. The target audience will receive diabetes educational material through the mail or through their healthcare provider if they attend online sessions. And for those attending in-person classroom sessions, they will receive the material in class. The information will be provided through a PowerPoint presentation, handouts, and worksheets. This intervention will take place over the course of 6 weeks. During the 6-week intervention, the participants will meet at the local hospital once every week for a DSME class for a total of 6 class sessions on different topics. The first and last class of the program will involve questionnaires on diabetes knowledge and skills, as well as the overall program. Each class will be 2 hours in length with a 30-minute break for snacks and other needs. For the first and second class, information regarding the condition of diabetes will be provided using information from the American Diabetes Association website. This will include the different types of diabetes, understanding blood glucose, target blood glucose levels, blood glucose self-monitoring, knowing medications, complications of diabetes, and benefits of diabetes self-management. For the second class, information regarding the diagnosis of diabetes, such as type, signs and symptoms, fasting blood glucose, anytime blood glucose levels, low and high blood glucose levels, factors affecting blood glucose levels, A1C tests, and when to contact a doctor will be provided on handouts and through the PowerPoint presentation. This information will come from the American Diabetes Association website and translated in a way to where the audience understands the information. Examples being provided will be the A1C and the FPG charts provided by the ADA. This source also provides valuable information that will be included on the handouts on prediabetes and preventing type 2 diabetes. Another source that will be provided to each participant as a printed source is a blood glucose logbook, which can also be found on the ADA's website. The third class will be about nutrition. The topics covered in the third class are goals for nutrition, such as blood glucose control, blood pressure control, lipid control, and weight management, nutrition information, and meal planning. One resource for nutrition provided by the ADA, especially meal planning, is Create Your Plate. This method is simple and easy to understand and is illustrated here. This helps participants to manage their blood glucose levels and weight. This method encourages participants to fill their plate with more non-starchy vegetables and less starchy foods and protein. There are 7 steps involved. The first is dividing a dinner plate into 3 sections, one line down the middle, and then putting another line through one of the halves. The second is filling the largest section with non-starchy vegetables while putting grains or starchy foods in one of the smaller sections. Protein should fill the other smaller portion. Participants are encouraged to add a serving of fruit and/or a serving of dairy. Further guidelines will be offered, such as healthy amounts and types of fats, carbohydrates, and proteins, low-calorie drinks, and the amount of water to drink daily. Create your plate information and further illustrations will be provided and can be found on the ADA's website. The fourth class will also cover nutrition, but it will cover topics such as nutrition recommendations, benefits of proper nutrition, nutrients affecting blood glucose levels, different macronutrients such as carbohydrates, fats, and proteins, and their importance, amounts and calories per gram, artificial sweeteners, reading a food label, and calorie counting and portion control. The fifth class will focus on physical activity. The topics that will be covered are recommended daily activity, how to increase physical activity, benefits of physical activity, complications of physical inactivity, exercise frequency and time of each session, exercise tips regarding monitoring insulin and blood glucose levels, wearing diabetic identification, proper clothing and shoes, etc., and physical activity goals. An example that would be provided in the handouts for this class will be information regarding both cardiovascular exercise and strength training, which can be found on the CDC's website. This resource goes over how exercise impacts blood glucose levels, benefits of physical activity, and ways to get started. Another resource for this class is the video presented on this slide that was posted in 2011 called Practical Tips and Action Steps, Physical Activity by the National Diabetes Education Program. And I will play that for you now.
Physical activity is important for people with diabetes and for people who are trying to prevent diabetes. Physical activity can help your body use insulin, which will help manage your diabetes. Physical activity can lower a person's blood glucose, lower a person's blood pressure, and lower your cholesterol. Physical activity can help you lose weight or maintain a healthy weight. Studies have shown that a 5 to 7% weight loss can help to prevent type 2 diabetes or control diabetes. That is, if you are a person of 200 pounds, a weight loss of 10 to 14 pounds can be very beneficial for the prevention of diabetes. Remember to always talk to your healthcare team before you start a new physical activity program. Adults should get at least 30 minutes of moderate intensity physical activity at least 5 days per week. Moderate intensity activity would be considered a brisk walk. There are ways you can increase physical activity in small segments throughout the day, such as taking the dog for a walk, going out and playing with the kids, or if you're on the phone, walking around. Don't just sit in one place. Well, physical activity is very diverse. It doesn't have to mean going to a gym. If you're sitting in your armchair, just move around. You just have to be active. Just keep moving. Some ways of increasing your physical activity could be when you go to shopping, parking a little bit further away from the store. Possibly, instead of taking the elevator, take the stairs. You can, if you're watching television, stand up, walk around, dance around your home. There are many ways to improve your physical activity. Kids and teens should get an hour of physical activity every day. It doesn't always have to be all at the same time. You can take a walk with your family, you can be out on the playground, or you can take the dog for a walk. If you have diabetes or any other health condition, talk to your healthcare team about your medications, both prescription and over-the-counter. If you have problems such as heart disease, kidney disease, foot problems, or eye problems, talk to your healthcare team about what physical activity would be best for you. To learn more about physical activity and diabetes, visit the NDP website at yourdiabetesinfo.org.
Next, and the last class, we'll go over previous information learned as well as stress management through coping methods. The topics that will be covered are examples of stressors, signs of stress, stress management methods, anxiety and depression information, feelings related to the condition, getting help, and acceptance of the condition. One example of a handout provided during this class can be found on the American Association of Diabetes Educators website. It is a flyer that was designed by the AADE and can be found in both English and Spanish. It provides excellent information regarding methods of healthy coping for stress management for those with diabetes. Addressing needs and meeting goals and objectives. One of the identified needs mentioned by community members was more guidance on healthy behaviors as well as the diseases that accompany poor lifestyle choices such as diabetes. The health education program is aimed towards guiding individuals on how to develop and maintain healthier self-care behaviors. At each class, 6 total, participants will receive handouts regarding the topics for that specific class. As mentioned in the previous slides, for the first and second class, information regarding the condition of diabetes will be provided. The third and fourth class will be about nutrition. The fifth class will focus on physical activity. The last, or the sixth class, will go over previous information learned as well as stress management through coping methods. In addition to the guidance of healthy behaviors, participants will receive a worksheet at each class for personal goals they would like to achieve, as well as make updates to those goals throughout the program. These goals relate to the 7 self-care behaviors defined by the American Association of Diabetes Educators, to determine if changes have occurred for the participants in the diabetes health education program. An outcome evaluation with a pre-experimental, a pre- and post-test with follow-up design will be performed, which will be explained in a later slide. Data will be collected before the program, immediately after the program, and 6 months after the program has ended through various techniques such as questionnaires, interviews, and document review. Back to the self-care behaviors. There are 7 self-care behaviors defined by the AADE, also known as the AADE 7 self-care behaviors, that work as an outline for patient-centered diabetes self-management education and care. These behaviors have been identified as essential for successful and effective diabetes self-management. These 7 self-care behaviors are healthy eating, being active, monitoring, taking medication, problem-solving, healthy coping, and reducing risks. At the end of each class, the participants will be provided with time to ask questions and receive answers regarding the topics for that class. The self-care behaviors that will measure the outcomes relate to the goals and objectives of the program for the participants. Establishing these self-care behaviors among program participants would potentially deem the program successful and effective in diabetes self-management. One goal is to increase awareness of diabetes within the local community. While this does not directly relate to specific self-care behavior, it does focus on informing and preventing future cases of diabetes. Another goal is to increase the physical activity or exercise levels among participants, which relates to the being active behavior. Another goal is to increase healthy eating behaviors among participants. This is in line with the healthy eating behavior. A fourth goal is to improve A1C levels among program participants, which would fall under the monitoring behavior, as well as taking medication and reducing risk behaviors. A fifth goal is to improve participant knowledge of how to monitor their own blood glucose and insulin levels. This goal falls under the monitoring behavior as well. The sixth goal is to improve participant lifestyle balance. This goal relates to the problem solving and healthy coping behaviors. The final goal of the program is to increase self-management skills for either the prevention or healthy maintenance of diabetes of the participants, which relates to all 7 self-care behaviors defined by the AADE. The program's projected goals and objectives seek to educate and encourage proper nutrition, physical activity, maintaining healthy blood glucose and insulin levels, as well as lifestyle balance. Establishing the self-care behaviors lead the participants towards attaining the overall purpose of the program, which is further knowledge on and better self-management of their condition. This communicates that the program will be effective and successful in meeting its projected objectives. Components of implementation. Implementing the program requires identifying, analyzing, and prioritizing both the health needs and desires of the target population, as well as the reasons behind the population's vulnerability, statistics and trends for the target population regarding the health concern, and any cultural factors, health literacy level, or issues, and other considerations regarding the population. As mentioned previously, 5 focus groups in the city of Virginia Beach were conducted in 2016 to gather information regarding the health needs of the community. Those chosen for the focus groups were community members that represented a diverse cross-section of city residents. One of the major key health issues participants identified impacting the community of Virginia Beach was diabetes. The health needs listed most often as concerns were obesity and related issues, including difficulty accessing healthy food, the need for guidance on healthy behaviors, and lifestyle-related diseases such as diabetes and hypertension. As mentioned, one of the needs is for more guidance on healthy behaviors, as well as the diseases that accompany poor lifestyle choices such as diabetes. The reasons behind the population's vulnerability, statistics and trends for the target population regarding the health concern, and other considerations regarding the population have been mentioned previously. An evidence base for action should be developed. Effective diabetes education programs need to be researched and compiled. To start the program, the support of stakeholders is needed, as well as other factors. Funding will need to be organized and secured, as well as the location of the program, which would be at a classroom at a local hospital. The development of local hospital organizations and local health department partnerships is needed. A certified diabetes educator will need to be recruited and hired, as well as outreach staff and volunteers. Participants will need to be recruited. Educational materials, data collection materials, and a curriculum need to be created and obtained to start this program. Flyers, social media posts, radio announcements, and other forms of information need to be developed in order to get the word out about the program amongst the local community. The equipment, such as computer, projector, printer, internet, and other devices needed to deliver the classes to the participants needs to be either purchased or borrowed. Other items that need to be purchased for the program are diagnostic supplies, which include blood glucose meters, blood glucose strips, lancets, and alcohol pads. Information regarding the program's target population, location, time, topics, and so on needs to be dispersed throughout the community using flyers, social media posts, radio announcements, and other forms of communication. Some stakeholders that may be involved in the diabetes health education program include national groups such as the American Association of Diabetes Educators, state health departments and state advisory councils, healthcare systems such as Centera and Bon Secours, healthcare organizations such as Virginia Health Quality Center, payers such as Anthem Blue Cross and Blue Shield, Optima, and or purchasers / large employers such as the City of Virginia Beach and public schools, University of Virginia Health System, and Bon Secours Health System. The Centers for Disease Control and Prevention and the Virginia Department of Health grant funding for health districts located in high risk for diabetes areas of the state. The Virginia Department of Health may also grant funding for the improvement of already existing diabetes prevention programs. Partnerships would need to be identified and formed. There would also be a need to gather an appropriate number of staff for the implementation of the program. The program would require some paid staff and some volunteer staff. Volunteers could be found through social media, newspaper listings, flyers placed throughout the city, and many other options. While implementing this campaign, momentum will be maintained through regular communication regarding the program's progress towards its goals that have been set. To further improve behavior change, the communication of accurate and timely information to the healthcare community, decision makers, and the public will be maintained. By continuously monitoring, evaluating, and making changes when needed to the program, momentum can be maintained through continued growth and development of the program, as well as the commitment to attain resources and support for effective action. Evaluation ensures that the strategies being implemented within the program are working in the way they were intended to, as well as ensures that the efforts are as effective and efficient as possible. Program evaluation is important because it critically assesses a program. It helps to ensure that a program's resources and activities are working towards accomplishing the goals and objectives for the program. Improving the program design and implementation can help advance environmental education. Being able to identify which areas of the program need improvement can really improve the effectiveness and encourage further support for the program. The collected information allows for better communication of the program's impact on others, which is also important for attracting and retaining support from current and potential stakeholders. Evaluation is a valuable process that should be used as an ongoing management and learning tool for a program or even an organization. Regularly conducted evaluations can greatly improve the management, effectiveness, and success of an organization and its programs. Implementing the campaign, barriers and solutions to barriers. There are barriers and issues that may impact program implementation and the ability of the program to meet the goals. One barrier is transportation to the classes. The City of Virginia Beach has both affordable and reliable transportation options for residents that provide access to healthcare, schools, jobs, grocery stores, and other resources that are beneficial to one's health. If a person is either unable or does not want to take the public transportation, there are both walkways and bike paths available around the city. Those who utilize public transportation also utilize the walk or the bike paths to access the transportation options. The public transportation options include the Hampton Roads Transit or the HRT bus services, VB Wave Shuttle, HRT paratransit services for those with disabilities, and walk and bike paths. The HRT paratransit service is a shared ride service, origin to destination, that serves Virginia Beach and many of the surrounding cities. This service utilizes various vehicles, which includes lift-equipped vans. A way to address this issue would be to provide free shuttle bus service to and from the classes to those in need of the service and cannot use other transportation mentioned previously. Another barrier could be access to healthy foods. This is an important factor when considering a person's health status. In 2012, about 49.5% of available food stores in Virginia Beach consisted of fast food restaurants and convenience stores. Grocery stores only accounted for 6.6%. The most prevalent type of food store within the city was full-service restaurants at 40.9%. Poor dietary choices can stem from limited access to healthier food options, which can negatively impact a person's health. There are close to 10,300 individuals in Virginia Beach that reside in a food desert or an area that lacks ready access to healthy foods at large grocery stores or supermarkets. A food desert is an area of low income with a higher number of residents that have little to no access to the larger grocery stores. A way to address this issue would be to provide the participants with information throughout the program regarding healthier food choices while eating at fast food restaurants or from convenience stores. Information will be provided on which foods are the healthiest, how to count calories, and how to read food labels. Another barrier participants could face is health insurance. Health insurance is important due to determining whether or not individuals receive the care they need and where they receive care. Health status and outcome can be affected by this factor. If someone does not have insurance, or it's not very good insurance, they may receive less preventive care as well as delayed care. Delayed care can lead to more health-related issues. In 2014, about 11.2% of the city's population was without insurance. Health insurance may be needed to pay for the program, which could be an issue for many of the participants. A way to address this issue would be to offer a sliding scale payment option based on income, so those who do not have insurance are still able to afford it. Also, the program could be funded by a grant, which would help cover some of the costs associated with the program. This would decrease the cost for participants. Another barrier is time. Some people simply do not have the time to make it to the classes. This could be addressed by offering online streaming of the classes, which would mean that the class was recorded and is able to be played back after class time. Another potential barrier is the participants' education levels. The Virginia Beach Department of Public Health mentions that one of the greatest predictors of health is a person's education level. Those who have reached a higher level of education tend to maintain healthier lifestyles and live a longer life. The city's population is well educated. Close to 32.7%, or one-third, of the city's population has reported having a bachelor's degree or higher. A barrier that may also fall under low health literacy is language. Barriers relating to language can impact healthcare greatly. Close to 12%, or 51,421 residents, of the city's total population, ages 5 and older, or 422,987 residents, reported speaking another language at home that was not English. About 34.6% of those that reported speaking another language, other than English at home, also reported that they did not speak English very well. Some of the other languages spoken were Spanish at 4.1%, other Indo-European languages at 2.5%, Asian and Pacific Islander languages at 5%, and other languages that accounted for 0.5%. Close to 88% of the city's population spoke only English. A way to address this barrier, or the barrier of a lower education level as well as the language barrier, is to make sure the health information and materials used in the program are created for low health literacy levels. This means that the information should be simple and easy to understand. The background and illustration should not be overly distracting. The information in the illustrations used should be inviting and friendly, as well as relatable to the target audience. Key points should be summarized and kept short and to the point. Scientific jargon should be avoided with the terms easy to understand. The reading level should not exceed a 5th grade level. The scope of the information provided is directly related to the purpose. The content is behaviorally focused. The content should also be relatable, culturally appropriate, and familiar to those from various cultural and racial backgrounds. The program information and materials could also be provided in both English and Spanish for those who speak both or only one of these languages. Another barrier is lack of support. This could be from stakeholders, staff and volunteers, and community members. This barrier could be solved by providing information on program progress, accomplishments, partnerships, and support from others. Another solution would be to have various contact methods for questions or concerns. Another solution is providing documentation that provides the efficacy of the program and its need for continued implementation. The final barrier would be poor participant engagement or interest in participating in the program. A solution would be to develop methods to motivate participants and ensure participation, such as incentives like recognition, a small gift, or other incentives. Another solution would be to reach out to other stakeholders to discuss suggestions and or create a plan for engaging participants, as well as building rapport to maintain their interest. Outcomes of the program. As previously mentioned, the self-care behaviors that will measure the outcomes relate to the goals and objectives of the program for the participants. Establishing the self-care behaviors among program participants would potentially deem the program successful and effective in diabetes self-management. Along with measuring behavior change with the self-care behaviors, the AADE mentions within their standards for outcomes measurement of diabetes self-management education, measuring clinical and health status outcomes at regular intervals before and after the intervention. The outcomes measurement of the 7 self-care behaviors is vital in determining the effectiveness and successfulness of diabetes education at both the individual and population levels. The AADE provided a DME continuum of healthcare outcomes, which brings awareness to the impact of diabetes education at an individual care level. Immediate outcomes include learning, knowledge, and skill acquisition. Intermediate outcomes include behavior change, such as the AADE 7 self-care behaviors core outcome measures. Post-intermediate outcomes consist of improved clinical indicators such as A1C levels, blood pressure, body mass index, and other factors. Long-term outcomes include improved health status, such as perceived health status, quality of life, and other factors. Program outcomes to be measured also include participation, program reach, satisfaction, topics covered, cost effectiveness, and other factors. These outcomes go hand in hand with the projected goals mentioned previously. When contrasting the outcomes to the projected goals of the program, it is shown that there will be a positive effect on the target population's behaviors due to the outcome measures touching upon each objective of the program. The program's projected goals and objectives seek to educate and encourage proper nutrition, physical activity, maintaining healthy blood glucose and insulin levels, as well as lifestyle balance. The identified outcomes lead the participants towards attaining the overall purpose of the program, which is further knowledge on and better self-management of their condition. This communicates that the program will be effective and successful in meeting its projected objectives. The outcome evaluation shows that the program would produce the expected results. With the program being effective, functional, and producing the expected results, it is important that it is carried through. This type of health initiative is essential in improving the health outcomes for those in Virginia Beach at risk for or with diabetes, which aids in decreasing, even if only locally, the overall health challenge of concern that affects close to 29.1 million people within the United States. Program evaluation method. An evaluation of a program may be conducted to gain insight, to improve how things are completed, to determine the impact of a program, and to affect those who participate in it. The CDC framework for program evaluation is often used for program evaluation. The universal components, or steps, found in most evaluation models using the framework include engaging stakeholders, describing the program, focusing the evaluation, gathering credible evidence, analyzing and interpreting data, or justifying conclusions, and using the findings or ensuring use and shared lessons learned. Along with the CDC framework for program evaluation, there are 4 categories for standards of evaluation that aid in reducing the risks of potential mistakes or errors in practice. These standards apply to all steps and phases of the evaluation plan. The 4 categories of standards are utility, feasibility, propriety, and accuracy. Utility means that the program serves information needs of intended users. Feasibility relates to being realistic, frugal, prudent, and diplomatic. Propriety means that the organization or the program behave ethically, legally, and with due regard for the welfare of those involved and those impacted. Accuracy relates to the evaluation being comprehensive and grounded in data. Here is the logic model for the Diabetes Health Education Program. A logic model places the main elements of a program into a picture that shows how the program works through a sequence of events that leads to the outcomes. The proceed model that was used for this program follows the structure of a logic model, which aids in building and evaluating a health promoting program. I have created this logic model to visually represent the outline of my program and the relationship among the resources, activities, and outcomes. This logic model assists in communicating the purpose of the program and its intended results and the actions expected to lead to those results. This model will act as a reference point for all involved in the Diabetes Health Education Program. The inputs are the resources that will be used to plan, implement, and evaluate the diabetes prevention program, which included human resources, partnerships, financial sources, equipment, educational materials, diagnostic supplies, and community resources. The activities named the actions that were to be taken so the program could be further planned and implemented. This included hiring a CDE, staff and volunteers, developing partnerships, checking classroom availability, researching and compiling effective diabetes education programs, creating the program and its materials, and other factors. The outputs were also necessary because these are the interventions that will be used in the program, such as Diabetes Self-Management Education Program, the approval of the materials used, developed partnerships, as well as other factors. The intended results are called outcomes. The logic model for Diabetes Health Education Program broke the outcomes up into 3 groups: short-term, mid-term, and long-term. This was so immediate changes, such as knowledge, attitudes, and awareness of diabetes within the local community, as well as the mid-term changes, such as behavior change, improved clinical indicators, and other factors, and long-term changes, increase in rates of prevention, delay, and or management of diabetes, improved health status, and reduction in mortality and morbidity that result from the other components of the model could be identified. Data collection is important. Evaluation and data collection. For both individuals and target populations, it is important to obtain data and measure the outcomes throughout program evaluation. The outcomes can be measured through questionnaires and face-to-face interviews provided before, during, and after the program, as well as through certain measurements taken before and after the program. The questionnaires and interviews work as the data collection tool used in pre-experimental, pre- and post-test with follow-up evaluation design. These data collection sources or methods will ask questions relating to diabetes awareness, so the condition itself, prevention efforts, signs and symptoms, etc. Self-monitoring blood glucose, such as the type of monitor, schedule, and other factors. A1C tests, such as when it was last done, the results, and so on. Nutrition behaviors, physical activity levels, comorbidities, current complications related to diabetes, health status factors such as blood pressure, body mass index, weight, cholesterol levels, and other factors, and stress levels and current coping methods. Data collection is important and needed to evaluate the impact of the program being provided to the participants. Understanding the degree to which a program was implemented as originally planned, program integrity, makes it less difficult to suggest associations between programs and outcomes. Program integrity should be evaluated due to the valuable information it provides to various stakeholders, such as program staff, administrators, evaluators, etc. Understanding how well a program was implemented allows for a clear picture of how the program and outcomes are connected. Implementations, evaluations, along with evaluation of outcomes, can provide information on program and practices effectiveness. This allows for the dissemination of programs and practices, as well as how to design and implement programs that produce proven effective results. Future application of information. It was learned that there will be a positive effect on the target population's behaviors due to the outcome measures touching upon each objective of the program. The program's projected goals and objectives seek to, again, educate and encourage proper nutrition, physical activity, maintaining healthy blood glucose and insulin levels, as well as lifestyle balance. The identified outcomes lead the participants towards attaining the overall purpose of the program, which is further knowledge on and better self-management of their condition. This communicates that the program will be effective and successful in meeting its projected objectives. The outcome evaluation shows that the program would produce the expected results. With the program being effective, functional, and producing the expected results, it is important that it is carried through and that the information learned is shared with others. This type of health initiative was essential in improving the health outcomes for those in Virginia Beach at risk for or with diabetes, which aids in decreasing, even if only locally, the overall health challenge of concern that affects close to 29.1 million people within the United States. Based on the learned information of this health initiative, it would be beneficial to apply this program's processes and results to future programs to improve the health outcomes for other health concerns impacting special populations. The information gathered through the evaluation report can be shared with others considering the development of programs that are similar to this one. The learned information may help to design similar programs more effectively, or it may convince others to utilize a modified version of this program to address the health needs of special populations and reach desired goals, objectives, and outcomes efficiently and effectively. Are there any questions? I would like to thank all of you once more for attending this presentation. I would also like to thank everyone for their consideration in participating and being a huge part of this wonderful program. As we move forward in our efforts, we can be assured that we have the potential to assist many who suffer from the risk of developing or who are currently diagnosed with diabetes within our community to live healthier lives. Thank you for your time. I look forward to working with every one of you. Have a wonderful day.